Living with any form of ailment is difficult. It is even more so for those afflicted with sickle cell. Sickle cell disease is a group of disorders that affect hemoglobin, the molecule in red blood cells that delivers oxygen to cells throughout the body. It is a situation in which red blood cells is semicircular in shape, blocking the normal flow of blood. The disorder causes infection of the lungs, liver, among others, but it sometimes manifests in shortness of breath, fatigue, and delayed growth and development in kids. The worst of all is the periodic excruciating bone pains sickle cell sufferers go through.
Pains. You'll be stroking them as if somebody pinching them with a pain. So along the line, they will now be complaining that, Mommy, Daddy, I'm feeling this area is choking me, even at the back, at the leg. This area is choking me, this area is choking me. So that is to let you that the crisis have already begun. So along the line, you see the temperature will just rise up. Later, they will now be shaking. So those are the symptoms and how the things have to affect them. That during that pains, it's a they experience very terrible pain, very strong pain. So very unbearable.
The disease has no particular cure, but its general treatment is aimed at managing and preventing acute manifestations. Information on early diagnosis and where to get help is vital, though.
Bringing the young ones to screen them for them to know their genotype and their blood group after teaching them. Then also those that is living with sickle cell disorder, we help them with their routine drugs, counsel them, make sure they do the right things, see the right doctors. When they are ill, they don't procrastinate, they go to the hospital. And also when the need be arise that they need blood transfusion, because we have a kind of relationship with the blood bank.
Babatunde Temiloluwa is 5 years old and he is a sickle cell carrier. Days like these are important in creating awareness so that people like him can get treatment that can prolong their lives. The Babatundes got married fully aware of their genotype, but we are hoping to have a child without the sickle cell anemia.
They said first, second, third, one day will be A, maybe AS. The fourth one will be SS. So we plan to have only three. We did not consider the exact. No, we did not consider what about miscarriages or the other side.
Statistics has it that about 1,000 babies born every day have the sickle cell disease in Africa, and most die by 5 years of age.
Somebody who has AS marrying somebody who has AS, or somebody who has AS marrying an AS, yes, thinking that it is 1 out of 4 is a mistake. Yes, your chances will be 1 out of 4, but the reality is that all the 2 or 3 or 4 children you have could be sicklers. It's possible that at every turn, each of the 2 of you will donate the S and the S. It's a mistaken notion to think that let me have 4, only one of them will be sicklers. No.
Although there are some genetic engineering remedies to sickle cell, people are advised to know their genotype early to avoid marriage between carriers. Wendy Ebo, TVC News, Lagos.